Okay, hello everybody. We tried live streaming this morning, wasn't working, so it's a little bit late today, and it's September 16th, 3:42 p.m. Pacific time. I am Dr. Rafage from Vet Triage, feeling much better. Just had a temporary cold or something, so much better now. Let's talk about those old joints in your dogs. So, and cats, I guess, but cats are a bit more subtle when it comes to arthritis. The timer just reset for YouTube, but I'm going to assume that the first 15 seconds saved. So let me know in the playback if we missed it, the intro. So arthritis in animals, more specifically dogs, a little bit of cats. I have a video on this channel. It's a bit more thorough as far as various interventions you can consider for pets who have arthritis. Feel free to check that out, give it a like and share it. But let's talk about it in brief here. So in general, or rather to go fundamentals here, arthritis can be broken down into categories. And there's really two broad categories of arthritis. It's either infectious or sterile. Sterile meaning non-infectious, and infectious being that there's an infectious organism that's the cause of it. So, for example, infectious arthritis are things like Lyme disease or other tick-borne diseases. For example, if you have a septic joint, so there's bacteria in the joint, that's an example of arthritis. And non-infectious arthritis are conditions like immune-mediated diseases or degenerative disease as you get older. So those are how we typically will classify them. We also can classify arthritis in terms of inflammatory and non-inflammatory, but technically speaking, if you're adding itis at the end of the word, it indicates inflammation, which is so it's inflammatory. And if you're talking about a non-inflammatory process in the joint, then technically it's called arthrosis. We will frequently just use arthritis to explain everything in terms of categorization, but just be aware that arthrosis is actually without inflammation and arthritis is with. So anyway, and of course, most joint disease in real life are inflammatory. I mean, so, there's a, anyway, so that's arthritis in a nutshell. As far as now, it's much more complex than that, and it goes beyond the scope of this live stream. So if you're noticing that your pets are showing signs of arthritis, and we're going to focus purely on the age-related arthritis. That's most common. The other types of arthritides is the plural, are more nuanced, and we can always talk about it in future videos if we want to. But signs that your pet has arthritis. So limping, stiffness, you can hear the cracking in the joints. They might walk, they may stand kind of bow-legged to take pressure off the joints. So they go like this to change the pressure, the axis, the weight-bearing axis. You may notice that the joints are swollen. You might notice that there's muscle loss on one leg more than the other, so they're no longer symmetric. And you may notice they're a bit more resentful when you touch them, especially certain places, to pet them, or they're not jumping as much, not playing as much, not climbing as much, etc. Cats are a bit more tricky, but they'll show signs like they're a little more subdued. They're getting a little more grumpy. They're maybe purring less or more. They're showing that they're in pain. And you may say, well, my cat's just being old and grumpy, but in actuality, they have arthritis. They're in chronic pain. And so it warrants a vet visit. If you notice a change in behavior with your animals, especially in the subset of animals that are prone to getting arthritis, like older animals, then you need to get checked out by the veterinarian. Vet triage is a great start. And then if you do go to the vet in person, they're going to recommend blood work and x-rays and then go from there. So if you're seeing those symptoms in your pets, then it's time to get them checked out. And especially if you're a cat, be a bit more aware, because they are very they're not as obvious with their clinical signs. That being said, what can you do to prevent arthritis, which is everybody's big question, right? Because it's one thing to treat, after the fact, but once the damage is there, it's there, and you're not going to reverse it. It only gets worse over time. Medication and things can slow it down, but it's not going to stop it. There's no cure. It's going to happen regardless. And so, how do you prevent it? Which is even better, right? It's better to prevent getting diabetes than trying to treat diabetes, for example. So things like joint supplements. So glucosamine conjoined is a very common one. Omega fish oil supplements, also another common one. Those are two good starts. Maybe pet multivitamins, although it might be questionable. Then there's other parts of it which concern lifestyle. So maintaining a nice lean weight, making sure that we're well muscled, make sure the joints are constantly moving, not constantly, but there should be a moderate amount of exercise that's appropriate for the age and breed of that pet, to keep those joints moving. Joint mobility is a big contributing factor to joint health. It's what helps nutrients get into the joints so that the cells that make up the joint capsule, and the joint itself can get nourishment, and they do that through motion. So moderate exercise, maintaining a healthy weight, and you can consider other things that are a bit more homeopathic, let's say, like physical therapy, acupuncture, actual homeopathic remedies. These all can help. And then you don't preemptively put your pet on anti-inflammatories or analgesics in case they get arthritis. That's not how it works. If there's no inflammation there, then there's nothing to treat, and you're only risking your pet side effects of the medication. So you're getting none of the pros and all of the cons. So you want to implement those things that I mentioned to try and help with prevention of arthritis, or really maintenance of healthy joints, because arthritis is probably inevitable in every animal, depending on factors, of course, comorbidities, age, breed, gender, etc. So yeah, so I think it's probably a good place to stop. Thanks for those who are watching on a playback and support the channel. Feel free to subscribe and donate. I'll see you guys again tomorrow, September 17th, for another video. We'll talk to you then. Bye. 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 Bye.